Hello and welcome to Counting the Cost, Al Jazeera's weekly business program. I'm Mariam Namazi. Coming up on the show, healing a nation. Can the US afford healthcare reform? Putting Dubai back on track. High hopes for the Emirates' new metro system. And is all that glitters gold? We look at the paradox of oil wealth. But first, in the US, Barack Obama has brought healthcare reform to the forefront of his political agenda. But will the US economy be able to shoulder that cost? Let's go over to our Washington, D.C. broadcast center, where Rosalind Jordan has more.
Yes, here in the U.S., the healthcare system has long been a subject of passionate debate. America spends more than twice that of other developed nations on its healthcare, but that spending does not translate into a healthier society. Let's take a closer look at some of the numbers. The U.S. healthcare system is a $2 trillion industry. That means $6,697 is spent per person per year on healthcare. In 2009, total healthcare spending in the U.S. is expected to reach $2.5 trillion, accounting for 17.6% of the gross domestic product. That's in contrast to the United Kingdom, which spends about 8% of its GDP, or $155 billion per year. Now, by 2018, national healthcare expenditure in the U.S. is expected to reach $4.4 trillion. That's more than twice this amount spent in 2007, and it's more than any other industrialized nation in the world. But public health care currently covers only about 83 million people. That's about 28% of the U.S. population. Meantime, the British National Health Service cares for all of its 49 million people. So the U.S. spends more than twice as much on average as other developed nations such as Canada and the U.K. However, it seems to be lagging in measures such as life expectancy and infant mortality. According to the United Nations, the U.S. ranks 38th in the world in terms of life expectancy. Compare that to Canada, which ranks 11th, and the U.K. 27th. The U.S. ranks 33rd in infant mortality. That's behind both Canada and the U.K. But perhaps the biggest problem is that of the so-called uninsured. That's to say, the growing number of Americans who are not eligible for public health care because they make too much money but they just can't afford it privately. Rob Reynolds sent this report from Baltimore.
On the surface, Karen Little has a typical middle-class suburban life. She's married, has a grown child, and a pretty house.
Sticker, come here.
But Little is living on the edge of disaster, both medical and financial.
These are to help me sleep. These are to help me stay calm during the day. This is to help me breathe. This is to help me breathe. This is to help me breathe. This is to help me breathe.
Little has a serious breathing condition and takes medication for a mood disorder and other illnesses.
This thing is $325 a month.
Her husband Tony has had heart bypass surgery. When he lost his sales job last year in the recession, the couple lost their health insurance. Now she's just one major illness away from bankruptcy. Little sometimes skips her medications just to make them last longer.
I have to sort of take one pill a day when it says take 2 pills a day because I can't afford it. That goes with this one.
She recently got a job, but she's not eligible for insurance for 3 months. And the mass of options and application paperwork is confusing and frustrating. The U.S. is the only highly developed country on earth that does not provide universal health care to all its citizens. Instead, an incomplete patchwork of coverage leaves an estimated 45.7 million Americans uninsured.
All right, little pinch.
Children, the elderly, and the most impoverished citizens are covered by government programs.
Let me listen to your lungs.
But the vast majority of adults below age 65 get insurance through their employers. And if you're out of a job, you're out of luck. Here in Baltimore, where Karen Little lives, fully 17% of the adult population doesn't have any health insurance. Most Americans agree the system needs to be fixed, but they disagree fiercely over how to fix it. President Barack Obama has made health care reform his #1 domestic priority.
Health care reform cannot wait, it must not wait, and it will not wait another year.
Some Americans fear that would be ruinously expensive. Obama's reform push is bogged down by a strong conservative reaction and resistance from powerful health industry lobbies and the Republican Party, which believes universal coverage is tantamount to socialism. He's been criticized for not showing leadership, and polls show support for reform is falling, along with Obama's approval ratings. Back in Baltimore, Karen Little wants fewer speeches and more action.
As much talk as you hear, as much noise as they're making, nobody is addressing the situation properly.
Rob Reynolds, Al Jazeera, Baltimore.
Joining us to talk more about the state of the U.S. healthcare system and reform is Dr. Laura Boylan. She's a practicing neurologist, and she's also a member of Physicians for a National Health Program. That's a nonprofit research organization which is aiming to establish single-payer national health insurance in the U.S. Dr. Boylan, we've seen millions of Americans fall through the healthcare gap in this country. What kind of impact does it have both economically and on the overall health of the nation's people?
It's really a terrible thing because the costs are just out of control and people can't afford health care increasingly. And with health care tied to insurance as it is and our system providing such low value, people are becoming bankrupt at rates unheard of before and simply doing without. It's about a third of Americans now who are cutting back on their own medical care because of high cost.
Do you think that the U.S. economy can afford a whole-scale revision of the healthcare system? We've heard President Obama say that he doesn't want to scuttle the entire system because it would be too detrimental to the economy.
I think really we have to have reform for the economy because getting low value for healthcare dollar is saddling the economy with the burden of a tremendously inefficient system right now. Right now we're spending about a third of all money spent on administration and inefficiencies, and plans which keep the special, uniquely American, for-profit industrial aspect of medicine in place aren't going to fundamentally realign incentives in such a way as to increase our healthcare value.
One thing that critics have been saying, especially in light of the president's speech this week, is that the savings can't be wrung out of the current system. What's your response to that?
I would agree with that. I think right now the proposal amounts to puffing more air into a flat tire because it doesn't touch the fundamentals of the private health insurance system and the pharmaceutical industry profits. It's in fact been designed in a very deferential way to those special interests in Washington.
Do you think that the Obama administration has missed an opportunity to say to members of Congress, this really is an issue of our morality and of our humanity, and you have to put aside your concern about getting reelected in 2010?
I would have liked to have seen that, and I would have liked to have seen a call for a single-payer system. I don't believe that it would be as disruptive as Obama said that it would be. Right now, somebody is 64 and turns 65 and enters the Medicare system, which is the American single-payer system for the elderly, and there is no disruption of health care. We have an unbelievable amount of insurance plan switching here under our current system because of the patchwork nature of it, and the idea that somehow it would be massively disruptive to switch insurance plans doesn't ring true for me. I think it rather has to do with special interests.
And finally, Dr. Boylan, and very quickly, will reform happen this time under Barack Obama?
I think it's likely that we get some bill through Congress and that he will sign it, but I'm not sure of that. It's certainly not a foregone conclusion.
All right. Dr. Laura Boylan, thanks so much for joining us.
Thank you.
4 years in construction and billions of dollars over budget, Dubai has just opened the Gulf's only metro network. This is just the first in an ambitious program of public transport being planned by the Gulf states. Abu Dhabi has announced plans to build a 131-kilometre metro system to be completed by 2016. And talks are also underway to connect all 7 of the United Arab Emirates by rail. Neighbouring Saudi Arabia is expanding its rail network too, building an east-west line which will link the Red Sea to the Gulf, a north-south line from the Jordanian border to the capital Riyadh, and a train service between the holy sites of Mecca and Medina. All are being built at a cost of more than $10 billion. In Qatar, the country is spending $25 billion on road, rail and air projects. Among the most ambitious ventures is a road and rail line to link Doha to Bahrain's capital, Manama. Dubai's metro is the first of these projects to reach completion. But unlike Abu Dhabi, Saudi Arabia and Qatar, Dubai is not cushioned by oil or gas wealth. And the opening comes amid an economic climate that has crippled this once thriving city. So will the metro help Dubai fight back or sink further into debt? Owen Fay reports.
Sheikh Mohammed bin Rashid Al Maktoum, Prime Minister and Vice President of the United Arab Emirates and the ruler of Dubai, is not a man you'd expect to bump into on the underground, which is why when he does ride the metro, a lot of people tend to notice. And in this case, Sheikh Mohammed was on hand to inaugurate Dubai's new metro system, a state-of-the-art rail network which is both a sign of the latest innovations in technology and a colossal gamble. If the plan works, this new metro system will serve as the backbone of a plan to pull this city out of a crippling recession. If it fails, recovery could be set back by years. For the moment, however, the directors of the network are keen to showcase their achievement.
We must feel very proud of what we have achieved, and the smile which we saw in the face of Sheikh Mohammed give us a lot of enthusiasm and give us a lot of energy to continue with the same momentum.
Around the world, Dubai has been one of the cities hit hardest by this economic crisis. In the past year alone, housing prices have dropped by half, and they're still falling. $500 billion of construction projects have either been suspended, scrapped, or totally restructured, which is why this project is so vital. Because to put it in another way, this city does not have the money for a project like this to go bust. And already this gamble is looking shaky. Only 10 of the scheduled 29 metro stations are actually open. And that's just on one line. The other one has been delayed and won't open until the middle of next year at the earliest. Cost overruns on this project have been enormous. Right now, estimates put the bill at $7.5 billion, double the original price. And that's not good news for the government at all. While the rulers of Dubai have guaranteed this project, state-controlled companies are running debts right now close to $100 billion. That's more than twice this city's GDP, and those numbers don't include this system. What's more, for the first time in its history, Dubai is running a budget deficit this year. The glory days, at least for the time being, are well and truly over. Owen Fay, Al Jazeera, Dubai.
Coming up after the break, a blessing or a curse? We look at the dangers that come with oil wealth.